Year 12. So this is Tuesday's lesson. So that's Tuesday the 28th. For those of you that are trying to keep on track and keep doing it on the days when you would have psychology, it's probably a good way of managing your time. Just before I start with this lesson, thank you to those of you who have completed the survey. I sent you a link to just a very quick student survey just to find out how you're getting on with the work and how you're finding it and if there's anything I could do to help. When I checked earlier, about six of you had completed it, so about half of you. I would urge the other half of you to do so, because it's just your way of saying, well, I want another lesson on this, or can you go over that? And what I'm going to do is, when I've got responses from everybody, I'll then pull together an additional lesson, which will just be picking up the bits and pieces that people say they're less confident with. So far, somebody suggested they want a little bit more on role of the father, for example. So please do. I am going to take notice of it and feed it in so that I can support you as best I can. Okay, so this lesson we are continuing on looking at our psychopathology topic, and in particular we're still on that first section of defining abnormality. How do we define when somebody has an abnormality? So as your retrieval task, I would like you to have a go at this. I'm going to move myself out of the way. We need to define or say what each of these key terms are. So we know that for this particular topic, there's a lot of these letter combinations. So we need to know what each of those letters stand for. And we should be doing this from memory to see where our gaps are, of course. And then an evaluation point, or 3 evaluation points about it, remembering that that can be strengths as well as weaknesses. So either print this or grab a piece of paper and just recall as much as you possibly can. Please don't cheat on this and, look things up. It doesn't matter if there's gaps. I just want you to try, because we know if you force yourself to retrieve knowledge, it strengthens it and it's more likely to get into that long-term memory. So it's really important, even though I'm not there watching you, that you don't kind of cheat on that one. Okay, so take a bit of time, no more than 5 minutes, and complete that task. Pause the video. Why is my PowerPoint frozen? Sorry about that. Had a minute there, my PowerPoint froze. Okay, so you should have done that. And these are the answers. So we'll just review these very quickly. So we know DSN, deviation from social norms. And I've highlighted these. These are all ways of defining abnormality, aren't they? So we need to keep that in our minds, that we're on that part of the topic. And all of these things that we're talking about are ways of defining and trying to identify who has a problem, who's got a mental health problem, or another word we use is a psychopathology, an illness of the mind. So evaluation wise, we can say, well, the problem with this definition is that social norms are culturally relative. We can think about those examples we looked at before, where this definition can be abused for social control. You can decide somebody's not fitting in with how you want them to behave, and then you can sort of lock them up, remove the problem. And it also doesn't allow for eccentricity or that individuality. It doesn't allow somebody to choose to be different. Then we have our failure to function adequately, our FFA, again, a way of defining. And this is helpful. And this links, you'll see there's a lot of overlap here between the failure to function adequately and the GAF scale, because these two things are obviously linked together. So it allows an assessment of how well someone can cope. One problem with this, though, is it could label someone as abnormal when actually they're just choosing to live an alternative lifestyle. So we might say they're not managing to hold down a job or to live in a home, but actually maybe they're choosing to be a traveller. It's an alternative lifestyle and it doesn't meet the points on the scale. And there's also this question of, can anyone really score 100 on that GAF scale? Is that really realistic? So linked to that, we've got our GAF scale, Global Assessment of Functioning. That's that scale, remember, 0 to 100, that's used to assess how adequately someone's able to function, to maintain everyday, daily expected sort of tasks and behaviour. And what's useful about that is it allows for us to prioritise, because basically, and this links here, it's quantifiable. We're putting a number on it. It's measurable. We're saying, oh, God, you're a disaster area. You only score 10 on the scale. we can then prioritise those people because they're a real danger to themselves or to society, and then intervene and provide treatment. So that's quite helpful. But again, we've got this problem. Can anyone really score 100 on the GAF scale? Is it realistic? And then we had our statistical infrequency, again, a way of defining abnormality. And that one was about any of those that statistically fall outside of that normal distribution. Remember that bell-shaped curve? So that's been useful because it's been used to diagnose that intellectual disability disorder. But it would label someone with a really high IQ, i.e. a genius, as having an abnormality. I'm not sure we're comfortable with that. And not everyone will benefit from being given a label. Just because you're outside of the statistical norm, does that mean you need to be given a label? Not everybody benefits from being given labels. Okay, so fill in any gaps, pick up on any of those things. All of the evaluation points I referred to there are referenced in the online textbook or in your topic companion, which you've got a copy of, and I'll come back to in a bit. So just to remind you where we're at, I'd like to show you the big picture, the context. So we're still within that subject divider of defining abnormality. We're still thinking about how we define and how we recognize when somebody has that psychopathology. So what we've said, there are three main questions to answer throughout this topic, and we're still on this first one. How do we define and diagnose mental illness? Reference to the knowledge organizer again. So far, we have looked at deviation from social norms, we have looked at failure to function adequately, and we have looked at statistical infrequency. And the one that we're going to focus on today is this one here, deviation from ideal mental health. We're also going to pick up on some of these other letters in here that we come across. So we're going to be thinking a little bit about some of those as well. So I want to show you a video clip now. Obviously, the video clip is on the PowerPoint, which is on Sims. And so you can pause this video, use the link, and watch the video. Okay. And it's by somebody called Dr. Satz, who's a psychiatrist, but he has quite an interesting view on whether we should be applying these labels or not to people. So it's around this idea of labeling. It's not the best quality video, and he has an accent, so you'll want to read the subtitles as well as listening to what he has to say. But it's worth it. Okay, it's only a few minutes, but it's quite a powerful argument. Okay, so pause me and watch him for a few minutes. Okay, so I hope you found that useful. It's quite interesting, isn't it, that when we think about it, it's all just behaviour. If somebody is behaving deviantly, they are behaving. Is it really right to label them and to give them a diagnosis of an illness? And I liked his example of the child with ADHD. We wouldn't have always labelled them as having ADHD. At one point, we would have just thought that's them behaving quite badly. They are quite boisterous. They are, they're full of life, full of energy. But now we would label them as ADHD. We would say that's not their fault. Let's take that kind of blame away, and let's say they need treatment, and we would give them drugs or some other form of medication, usually drug treatment. So is that morally right? Am I actually labeling somebody with an illness actually when it's their personality, it's their behavioral traits? And you could take that all the way across every disorder, actually. We call it the anti-psychiatry movement. I could apply it to depression. I could apply it to any abnormality if I wanted to. And I could say these are just a collection of behaviours. And there's always a reason behind those collection of behaviours. It could be that in the past you've experienced a trauma, linking back to our attachment topic. It could be that you failed to form those secure attachments as an infant. There's always a reason, but maybe it's not something that we should just put a medical label on and then try and fix with drugs. So that's a different approach. I wanted to introduce that to you because I want you to think critically about all of this, and that is a different approach to understanding this. So that's Dr. Satz, worth bearing in mind. And it got me thinking a bit further, and I hope it gets you thinking a bit further about, well, should we label people? So in your mind, I want you to think about depression, because even though we haven't yet studied it as a disorder, we've all got an understanding of what depression is, haven't we? We've got a vague awareness about depression. It's a term we hear often. We may well know people who suffer from depression. You may yourself have suffered from depression. About 1 in 3 young people do. So if we think about depression, and we've got somebody who's kind of showing those sorts of symptoms, okay, very low self-esteem, low sense of interest and motivation in things that they previously used to enjoy doing, maybe becoming socially withdrawn, moving away from social situations, very down, so a real low mood, struggling to motivate themselves to do basic things often, like get out of bed at a reasonable hour, have a proper meal, so they might find that they are eating much less, loss of appetite, these sorts of things. So if we label them as being depressed, there's a certain stigma that comes with that, negative sort of attitudes towards it. We are, of course, labeling them, and labels stick, we know that. There's a real difficulty in that person becoming fully rehabilitated, basically ever getting fully better, because that label sticks with them. And it sort of suggests that it can't be changed. Oh, there's a depressed person. They can't, it almost suggests that label is then with them. And even when there are a change in their circumstances, they are still a depressive. They are still depressed. So there's some real negatives, there's some real risks of applying these labels, which I guess was what Dr. Satz was saying. But in the reality, in the real world of psychiatry, there's some massive advantages. It's useful. So it allows for a shared understanding. If I say depression to any other clinician, any other clinical psychiatrist, they know exactly what combination of symptoms I'm talking about. So it's like a shared language. It can lead to that diagnosis and then the treatment. And surely that's the important bit. We want to make sure we're treating people. Linked to that, appropriate interventions. And generally speaking, when we say somebody is ill, there's more understanding, there's more sympathy. Oh, they're poorly, they're ill. Whereas when we just say they're behaving weirdly, they don't want to come out anymore, they're not eating properly, then we generally don't have sympathy. We sort of have a bit of sort of distaste towards them. So sometimes by giving a label, we increase that understanding and that sympathy. Not always, though. So labels they're a touchy subject. They can be useful, but they can also be quite harmful. So that's why it's so important when, as psychologists, people are deciding who's got this abnormality and who hasn't, that they're really careful, that they don't make mistakes, because labels stick. So that's a bit of context, and we can use that to help us with our evaluation as well. So a couple of other things I want to introduce you to. This is not yet looking at our fourth and final definition, okay? So be mindful of that. But you'll have seen them on your knowledge organizer referred to DSM and ICD. Now, these are 2 books. That's all they are, but they're really important books. They're manuals, if you like. And they are the manuals that doctors, psychiatrists, clinicians across the world use. And basically all they are, and we'll come across them lots of times throughout this topic, because we'll be looking at particular disorders and we'll be looking at what does this book say about them. They are lists of symptoms. So a doctor, when you go to them, and let's use that depression example, and you say, well, I've lost my appetite and I'm really struggling to get out of bed in the morning, not because anything physically hurts, but I just can't motivate myself and I feel really low a lot of the time. They can match up those symptoms, look in this book, match up those symptoms and say, yeah, okay, that matches up to depression. Obviously, they don't always need to use the book, but that's the reference point. So the names are important. They're a bit of a mouthful to remember, but they help you to understand how these books have come about. So the first one, the International Classification of Disorders, ICD. The clue is in the name. This is used internationally, okay? This is used across the world. And the 11 bit just tells us, oh, apologies. The 11 bit just tells us we're up to the 11th edition. DSM, the Diagnostic and Statistical Manual, again, the 5 is just we're up to the 5th edition, and we often represent that in Roman numerals, so you'll see it as a V. Well, it's a diagnostic tool. That's the D bit. It helps us to diagnose what's wrong with somebody. And the statistical bit tells us that this has been compiled by thousands upon thousands upon thousands of statistics over many years. The fact that we have to keep having new editions tells us that things change. New disorders or new variations of disorders get included and other things get taken out. And that's quite interesting, isn't it? How we can keep discovering new mental health problems. This is just for mental health disorders, both of these, just for mental health disorders. So a little bit of information at the side there. I know that's a lot to read. Obviously, you've got a copy of the PowerPoint. I'll not read it to you, but actually, the ICD is the one that's used globally. But what we find is that many people in Britain now, many psychiatrists are choosing to use the DSM over the ICD, partly because there's a lot more, it's thought to be somehow more accurate, probably because of the number of statistics that have gone into it. But with either of these, what we have to know is that they are diagnostic tools. They are reference points for psychiatrists when they're trying to diagnose. But actually what they don't tell us, they are just a cluster of symptoms. They just tell us what the symptoms are of a disorder. They do not tell us, or they do not give any sort of explanation as to why that disorder has happened for that person. And there's a whole lot of other things we have to think about. So this is just a reference diagnostic tool. It is not an explanation. If I've got my depressed person, yes, I can match their symptoms up in the book and decide, yes, they've got depression. I can't answer the question why, and I can't answer the question, therefore, how am I going to fix them? That's much more complex. But again, this is about labels, isn't it? This is about identifying symptoms. Okay, so reference to the online textbook. We are now moving on and we are looking at this deviation from ideal mental health. Remember, we've come across deviation before. It means you differ from, you're different. So let's have a little look. Now, we sometimes say this uses the medical model, okay? Because this is like how doctors deal with physical health. So first of all, bear with me, we're going to talk it through for a physically healthy person, okay? So if I go to the doctor has in their mind an understanding of what a physically healthy person will be like, what colour their skin will be. You know, is mine yellow? It shouldn't be. So then I'm deviating from their idea of what a normal healthy person is like. So if we look at some more measurable things, temperature, 37.5 degrees. If I deviate massively from that, I've got a problem. I've got fever or whatever, yeah? I've got a blood pressure of somewhere around 110/70. There's a range, of course, I don't have to be exactly that. But if I deviate from what's known as the healthy range, then the doctor knows, okay, there's a problem. The same with my resting heart rate. The same with my white blood cell count. I just picked a few examples, but of course there are many, many more. And that builds up a picture to the doctor of what a healthy person is. And if I go to the doctor with a few symptoms, they'll do those tests, won't they? They'll take my blood, or they'll take a urine sample, or they'll check my heart rate, my blood pressure. And if any of those deviate, they'll say, okay, then you've got some sort of an illness. Now let's dig a bit deeper. Let's find out what exactly. Let's use our reference guide. These are the symptoms. Oh, therefore, this is your diagnosis. Therefore, you're going to do this. That's the model, a medical model. Now, this definition says we should apply that exact same model to mental health. So let's have a look at it for mental health. We should still, they say, have an understanding of what an ideally mentally healthy person has. So this time we're not dealing with temperature and white blood cell count or heart rate. We're dealing with things which are much more abstract, much harder to measure, but that they say identify a mentally healthy person. And when I say they, you can see the name at the bottom there, Jehoda. That's an important name to remember. Jehoda is the person who came up with these 6 criteria. So each of these in the box are 6 criteria for ideal mental health. And exactly the same idea, if you deviate from them, if you haven't got any of these things, then that's where the psychiatrist would say, okay, that's an indication that you've got some sort of psychopathology, some sort of illness. Now let's get our manual out, let's get our DSM out, and let's see what disease or what illness those symptoms match up to. And that's the medical model. So let's have a little look in detail at these criteria, and these are all detailed in your textbook and in your topic companion. So a healthy person, mentally healthy person, will have an accurate perception of reality. They know what's real, they know what's imaginary. Yeah, they don't have hallucinations. They understand this is reality or this isn't reality. They know when they're playing a video game that's not real life. Okay. They have a positive attitude towards the self. So that's how you feel about yourself. So they've got good self-esteem, would be another way of saying it. They can resist stress. So, or they can cope with it. Okay. So yes, we all experience stressful times, but somebody who's mentally healthy can have strategies, can deal with that, and doesn't let that level of stress completely crush them. They have autonomy. That means they can make their own decisions and independence. They can become masters of their environment. Now, this is a silly way of saying it, really, but it is important you remember the terminology. But it's basically saying you can adapt your environment. So you know that you behave a certain way when you're in school, and you'll behave a different way when you're out socially with your friends, when you're allowed to be. It's about adapting to different environments. Yeah, and that's emotionally and physically, and we all do that without even thinking about it. But that's because we're mentally healthy. Somebody who's not mentally healthy might not be able to do that. And then this last one, we have come across this term before, self-actualization. Now, we came across this term when we looked at the humanistic approach in the approaches topic. And it's about fulfilling your potential. So Jehoda is saying that a mentally healthy person will have their goals, their aims in life, and they will work towards them. They will be able to fulfill their own potential as a human being. So if you've got all that, you're fine. And if you deviate from any of them, Jehoda says, then we need to look and diagnose what's wrong with you because you are not mentally healthy. Now, I don't know about you, but I see a problem with this, and this will help us when we come on to our evaluation, because I think some of these are a bit unrealistic. I think sometimes we all let stress get to us. Even if it causes us to have an argument with somebody, it's still stress, and we're not entirely resistant to it. And I think it's very unusual to find somebody who would say, oh yes, I've reached my full potential. And all of these are actually abstract concepts. It's not like when I go to the doctor and the doctor can take my temperature. They can't have a measure for my self-esteem. So there are lots of problems with using this definition, but there's also some advantages as well. So there is another little video clip. It's an animation. You could say it's a little bit naff, but I didn't create it. But the message behind it is a nice little summary. So what I would do is I probably wouldn't play it now. I would leave this when you finish this lesson and you've done the tasks associated with it. I would maybe just come back to that as a nice little summary at some point. But the link on the PowerPoint, when you get the PowerPoint from Sims, if you click on the picture, it'll take you to the web page. Okay. So this was just a reminder that last lesson you looked at, and thank you to those that have sent it through, an application question. So we were thinking about when we're dealing with definitions, how do we deal with an application question? A short question worth just say 4 marks, okay? With this lesson, we're moving it on to think about how we would cope with an extended question, a 16-mark question, because we've introduced ourselves now to all 4 definitions of abnormality. So statistical infrequency, DSN, social norms, FFA, failure to function adequately, deviation from ideal mental health just today. So this is the kind of question we might be faced with. specifying that we've got to talk about the failure to function adequately and the deviation from ideal mental health definitions, describe and evaluate these two. So we're going to have a little look at this together, think about how we might approach it. I'm going to model a little bit of it to you to help us with our evaluation, and then you're going to have a go. So first thing, break down the question. Let's see exactly what we're going to be expected to do. Well, it's 16 marks. It's describe and evaluate. So I know my describe is my AO1. I've got to show knowledge of these definitions, the two definitions that have been given to me. I know that evaluate means strengths and limitations. I know that will be, I've just spotted a mistake on there. Apologies. Don't know what I was thinking. I know that it will be 6 for AO1, 6 marks for knowledge, and 10 marks for evaluation. We know there's more evaluation needed. So then if I think about my knowledge, I've got 6 marks. I'm going to need 2 AO1 paragraphs, 3 marks about the failure to function adequately, and 3 marks from the ideal mental health. So I need 2 paragraphs showing my knowledge on each of those definitions. Okay, and I say P paragraphs because it's nice to say point, explain, evidence, just to really develop that. And then over this side, I know I need 10 marks now. So I'm going to get roughly, it doesn't work out perfectly, but 5 marks for evaluating the failure to function adequately definition and 5 marks for evaluating the deviation from ideal mental health. Now, what that's going to translate to really is 2 Peel paragraphs, 2 evaluation paragraphs on both. So I'm going to end up with 6 paragraphs overall. The order in which I put them does not matter, okay? But that's what I'm aiming for this type of question. So I'll model you through a little bit of it, not the whole thing. So my first step would be, and I'm going to do it for the ideal mental health one, so this is just one part of the essay, be to come up with my AO1. Now, I'm just literally saying what I understand about this definition. So I'm saying deviation from ideal mental health definition uses a medical model, so I wanted to get that in there. There's a concept of what ideally mentally healthy person's like, and anyone who deviates from this, I'm using that language of deviates, is considered to have a psychopathology. So that's my point, essentially. Then I'm going to explain it further, and I'm going to bring in my examples. So Jehoda identified 6 criteria, which included, then I list them. These criteria are often lacking in those who have mental health problems, and this definition applies this approach to identify them. And that's it. That's my AO1 paragraph. I've got Jehoda in there, I've got medical model, and I've listed the criteria. And I've talked about deviating from the criteria. Job done. AO1 paragraph. Step 1. Step 2, I need to start preparing. If I'm focusing on my ideal mental health, I need to start planning and preparing what my evaluation paragraphs are going to be. Remember, I need 2 of them. So I'm going to just literally list the strengths and limitations of it. Now, where am I going to find this? I'm going to find it in my topic companion, which I attached to Sims at the start of last week, and in the online textbook. So I'm going to pick them apart and I'm going to list them. So for me, I did that and I looked at ideal mental health and I said, well, it contains some quite unrealistic criteria. Everyone feels stressed sometimes. There's positive features as well as negatives. That's a good thing. We're not always focusing on negative things. So things like self-actualization, that's a good thing. Holistic, comprehensive view. It does consider lots of aspects of humans and human behavior. So we can say it's holistic. It looks at the whole person. It's a really comprehensive view. So that's quite a positive thing. But it's culturally relative. What one culture says is important, another doesn't. So Jehoda said autonomy, making your own decisions, acting independently. Well, not every culture will think that that's important. You'll see that in a minute when I give you an example of a paragraph. And it doesn't consider individuality, individual differences. It says we should all be like this. Are you like that? No. Oh, so you must have a problem. So again, it doesn't consider that individuality. That seems to be a problem with a lot of these definitions. So I list my evaluation points, okay? And that'll be useful to have as a bit of some notes in your file. And then I construct it into a paragraph. Now I'm using the peel structure. So I'm making my point, I'm explaining it, I'm providing the evidence or examples, and I am then linking back. The linking back is I am saying why it matters. And those are the 4 colours that you've got there. So if we have a little look, one of the limitations of using this definition is that the criteria reflects a Western view. I've just made my point, that's it. Then I need to explain that. So in this way, we can argue that they're ethnocentric and are created or centred around a particular cultural view. So I'm explaining what I mean by this Western view. Then I go on. For example, the idea that it's an ideal characteristic to reach self-actualization and fulfill your own potential as a human is much more consistent with an individualistic culture like Britain or the US than it is a collectivist culture where people are more likely to want to work for the goals of the wider community. So we've come across this before, this term individualistic and collectivist. We came across it when we were doing the attachment topic and we were looking at cultural differences in attachment types. Here we're using it to say, well, of course you're not going to be self-actualized if you live in a community in tribal Africa and everything you do is about the goal of the community, of the village. You're not going to be self-actualized because you're not selfish. You haven't got your own goals. So I've given an example. And then why is it important? This is so important in your paragraph to have that link back. So this is important because it means we're trying to use this definition across different cultures, and there's a danger that we're labeling people when their cultures just taught them otherwise. Now that link back is the bit that students always miss out, and it's the bit that allows you to get your analysis and evaluation marks. So it is really important. And I don't care whether you start every final sentence of every paragraph like that. This is important because you'll get the marks. It doesn't matter if it gets boring. So that's the peel structure. So you've seen the question. We've broken it down. We know we need 6 paragraphs, 2A01, 1 for each definition, 4 peel paragraphs, 2 for each definition, where we get our evaluation in. This is your task. You're going to plan it. You're going to write it in timed conditions. You can type it if you like, I don't mind. And then you are going to email that to me, whether it's a typed document, fine, attach it, or if you've handwritten it, photographs of it, might have to be several photographs so I can get the full essay, and attach them to an email by Friday. So this that you've just sat and listened through is Tuesday's lesson. Wednesday is your planning and your writing, and you send it to me, and then there'll be another lesson for Friday. Okay, the different lesson coming on Friday. But I really would like you to make sure you do that and you send it through, because I don't want there to be this big gap where you haven't written a psychology essay for ages and then we come back to school and I'm suddenly like, you've all forgotten how to write essays. Okay, so it's really important that we keep that going. All right, so you'll find there won't be a lesson posted on a video lesson posted for Wednesday. On your Sims, all it'll show up is that you need to complete that essay question, but there will be one on Friday, so look out for that. Okay, and then my final thing to say, as I have been every lesson, some suggestions for what flashcards you might create. Okay, building on what we've done today. So that'll be another little task just to keep you on top of your retrieval. Don't forget to revisit the ones you've already created. Get somebody to test you when you've got a spare 5 minutes. All right, Year 12, thank you very much. Take care of yourselves. Stay safe.